cancer is another case of diseases like home that abnormal cell divided, uncontrollable, destroy the body tissue.
All right.
Are you hearing me?
Very well.
Good. And the most common type of cancer diagnosed in the children we call leukemiasis.
All right.
And sometimes other will be affected from the brain and the central nervous system.
All right.
Which we call a CNS.
All right.
And sometimes it causes tumor.
All right.
That's lymphocytes.
All right.
Yeah. And then the most common of cancer in children, that leukemiasis, are the cancer of the marrow of the bones.
All right.
And the other type of leukemiasis in children that we know, we call it lymphoblastic leukemia. That is ALL, the acute lymph node and the tumor. But sometimes they almost affect a children about between childbirth about 14 years age, which cancer is very different for the adult cancer.
All right.
Are you getting me? Are you there?
Very well.
Good. Apart from the high dose of the radiation and the dose of chemotherapy, it puts strong and external risk factors for the relative, and the risk is the heredity. That the heredity, we call it genetic factors with the child being had a parental age.
All right. That's hereditary.
Yes.
All right.
Yes. That is the commonness, the genetic, that's the history of the family. And sometimes we have the problem with the development of the wombs. And thirdly, we have the exposure of the infection to the when you're exposed to the infection and previous treatment of the cancer.
All right. So doctor, let me ask you this now. What would you advise? What are the common cancer that parents, guidance, or should I say adults should look out for in children? I mean, they should open their eyes at, and then looking out for in children, or whenever they see this time, they should perhaps go for checkup. What are those common, cancer in children?
Yes. For you to know when your children have a cancer, there's something that unexplained or unnecessary sometimes bleeding. It happens.
All right.
Sometimes it's such like a urine when it happens. And sometimes it will be a sickness that very easily for the rashes of the body, the small spots and the skin. So this is persistent or unexplained swelling of fever, goes and on. Sometimes you see a flu coming up and on, in high blood temperature, it occurs.
All right.
Yeah.
Yeah, continue, please. Yeah, doctor, can you hear us?
Yes, sir.
Yeah, please continue.
Yeah. And another thing that whoever is very big tire, sometimes noticeable of the skin, that painless, sometimes a lot of infections such as the ear, throat, or the chest pain that goes and comes. So, but in the parental care now,
Yeah.
we need a parent to provide a child with the key information. What kind of key information they provide is we let them know that the cancer is actually a general name for many different diseases,
Yeah.
which can make a normal divided but not rapidly grow.
All right. Yeah. All right. So doctor, let's take it from this angle now. We know that when a child, or as a child or children, the most thing that we find them is learning, going to school, and we have this should I say cancer of the eyes. So we want you to look at it from this angle now. When the child is perhaps having a vision, is having vision impediment in some cases, what would you advise the parents or the teachers or should look out for to perhaps detect that something is wrong? Because the child may not really know that something is wrong, but there are some signs that it should tell you that something might be wrong in that angle.
Yes, because of the general position is not to prevent cancer in children.
Yeah.
The most effectively strategy is to reduce the burden of cancer in the children. That's to improve the outcome and focus to appropriate correction diagnosis. Are you getting me?
Yeah.
And follow effective evidence-based therapy and the supportive care. What are the basic therapy we are talking about? Is that we can diagnose if a parent can diagnose by self by